Welcome, everyone, and thank you for joining us today to discuss technology and hardware solutions for healthcare. My name is Brandon Sorensen with Rahi. For those who don't know us yet, Rahi is a California-based IT and AV solutions provider with locations across the US and around the world. We provide a full life cycle of design, products, and services to custom fit the technology needs of corporation and healthcare providers globally. Our goal for this webinar is to provide you with the information needed to help solve any challenges you might be facing today within your unique environment. Since the start of the pandemic, we get a lot of questions around what technology and hardware can be used to improve the daily experience for our staff and patients, and how can we make that experience seamless to all users. Since every user's needs and environment are unique to what you're trying to accomplish, it's important to bring a solutions provider like Rahi into the conversation early to help identify those needs and what technology and hardware will best help solve those challenges. For today's webinar, we wanted to bring Zoom and Logitech into the conversation since these two companies have been at the forefront of solving these challenges through their products and technologies, and they've placed an emphasis around solutions for healthcare. Their focus and goal during COVID is to engage individuals and providers with a very immersive experience while simplifying the technology for users to make that experience seamless. Before I introduce you to today's panel, I have a couple quick house cleaning notes. We do have a Q&A section here in the webinar, so if you have questions that come up during the webinar, please post them there. We have about 5 minutes at the end here to go over any questions and get those answered for you. If you have additional questions after the webinar is complete, you can email the Rahi team at questions@rahisystems.com. And most of you have been invited here by Eric Horn. Eric will reach out to each of you after to see if you have follow-up questions and see if you want to meet with our team here at Rahi to discuss any options or challenges you might be facing today within your environment. So with that said, let me introduce you to today's panel. From Zoom, we have John Stearns, and from Logitech, we have Roseanne Cohen. Welcome, panel, and thank you for joining us today.
Thank you, Brandon. It's great to be here.
Yeah, thanks, Brandon.
Roseanne, let me start with you. As we know, the global pandemic has accelerated the use and adoption of video conferencing within the healthcare environment. As we transition into a post-pandemic phase, how do you foresee video being used in the healthcare space?
Well, thanks for the question, Brandon. First, I'd like to take a moment to acknowledge all of our healthcare heroes, our leaders and administrators who are attending today. In addition to having some experience deploying video collaboration solutions within health systems, as well as school-based healthcare environments. I have a daughter who works at the University Medical Center for the past 4 years. And so I'm very aware, she's made me very aware of the challenges that staff face and that hospital workers are facing. So thank you very much. And that just kind of leads me to what our focus is. Logitech solutions are used throughout the healthcare industry and are targeted at supporting the quadruple aim goals of healthcare organizations. And it's on these 4 key areas, helping them support better outcomes for patients, improving patient experiences, improving clinician experiences, as well as lowering cost. Logitech solutions help to deliver those better outcomes by providing that high quality HD video conferencing experience and those high quality audio experiences that help to support privacy between a provider and a patient, or that high quality experience that builds trust and that personalized care. From an improved patient experience, patients are looking to access care where and when they want it most, right? They want to be able to have that same convenience they get from mobile devices, to have the same access to their provider over video these days. So it's that consumerization of video in healthcare services. And then if you look at improved clinician experiences, you don't want to improve all these other benefits and deliver all these benefits without taking in consideration the needs of the providers, needing to ensure that they are efficient, they're able to leverage these tools within their workflows to be efficient and productive. And then as a health system achieves these productivity improvements and these efficiencies, they're able to capture that and extend the cost savings to patients to deliver low cost. So that's, this is kind of a high level overview of how we support the goals of a health system. And we support with our technology very specific use cases with video collaboration.
And Roseanne, we've seen a lot of new use cases, as you mentioned, come out of the pandemic. Can you tell us a little bit more about that?
Sure. Let me just begin by laying the groundwork. So some of the leading use cases of Logitech solutions, along with the Zoom platform, are around these four key application areas. So patient care, those experiences that take place between a provider as well as the patient. So that could be obviously those patient encounters, telehealth visits, urgent care, just those that could be chronic care management, those video visits that you have to supplement those visits. Then you move on to the administration, the business of healthcare, where you'll see our technology deployed with Zoom in conference rooms in a corporate type setting. And then if you move on to education and training, you will find Logitech solutions in auditoriums, and you will find them in different university medical centers to support that continuing medical education. And then if you move on to research and development, the partnerships that you'll see between a university medical center or a health system and a medical device manufacturer, helping them develop products, or bringing drugs and products to market more quickly. So these are just some of the unique use cases to support telehealth throughout the healthcare industry.
That's awesome. And John, with so many use cases, there's a tremendous opportunity to leverage collaboration tools to help solve these problems. Can you share a little bit how Logitech and Zoom work together to solve this?
Sure. Yeah. So thanks, Brandon. Zoom really takes a video first approach to communications. So wherever you collaborate, we're able to deliver all your enterprise communication tools from a single platform. That really can be accessed from any room, any device, doesn't matter if it's from your pocket or your desktop to a conference room or the operating room. And the value that we bring specifically with Logitech is unique as we move into the healthcare space. Logitech's devices are simple, they're easy to use, and they deliver this plug and play experience and a lot of options that are already certified on the Zoom platform. So really at the end of the day, providers really have the confidence that they need to focus on what really matters most. And that's the patient, not the technology.
And if I could just jump in here too, what I love about this image, John, is how you really can see the entire communication suite that a user might have. It might be over a voice call, it might be over video. And Logitech solutions align specifically to those Zoom room licenses. It aligns to those audio calls or those chat capabilities. We have keyboards and mice to help you type more efficiently. And we have those webcams that provide you that higher quality experience, and then headsets that go into that high quality voice experience that you would get with the Zoom platform as well. So I think when you look at the value our two companies bring together, it's really about empowering healthcare providers, workers, and their staff with the Zoom platform, making it easier to schedule appointments, making it more natural to communicate daily, and for those critical emergency use cases as well.
That's awesome. And I find it best to understand how these technologies are solved really by looking at case studies, and they're one of my favorite things to look at. We do have a case study ready to go here for our viewers. Simon, if you can go ahead and roll that.
Moffitt is an NCI-designated comprehensive cancer center located in Tampa, Florida. Moffitt's mission is to contribute to the prevention and cure of cancer. Just over a year ago, we evaluated our communication solutions and realized that we had a real problem.
We needed a holistic solution, a single point solution that would make it a seamless, easy to use experience for bridging the gap between locations.
One of my colleagues at USF, they were actually doing a trial of Zoom. We reached out to him and did a walkthrough of how the Zoom room was set up, and we loved it from day one.
We started with a pilot of IT of about 300 or so folks, and then we took it to 6,000 people and deployed it in a matter of 2 weeks.
Just deploying Zoom has been very easy to do, whether it's because of the platform or it's because of the excellent support that Zoom provides.
We've got one platform to support, one platform to answer questions about, and one platform to deploy.
We live in Florida, so we're in a hurricane state, so we have to be prepared every year. With the Zoom platform, being in redundant data centers allows us the ability to actually have conversations when we're under a hurricane warning.
So we are deploying Zoom rooms across our entire organization, replacing all of the legacy hardware in those rooms with the Zoom-enabled hardware.
Typically, when we do a new room, we'd have to work with our AV integrators to get it scheduled and installed. Now, if it's one of our smaller medium conference rooms, we can do it ourselves. It literally takes 30 minutes.
And we've been able to move this through the organization quicker than we ever have with any other solution. So we're initiating a pilot right now to involve our pathology teams with our OR teams, where they will be able to collaborate with each other real time, audio and video, while the patient is in the operation. It decreases the time the patient is under anesthesia and provides us a better means of communication with our pathologist and our operating team.
We knew that Zoom was HIPAA compliant, and for us, the HIPAA compliancy is an incredibly important piece of any communication platform. Consolidating onto a unified communication platform to allow technology to enable our business, to enable our strategic plan, and to drive our research forward. Zoom enabled us to do that.
Thank you, Simon. What a powerful case study. I love how that shows how Moffitt took it from concept to full adoption within their environment. And we know, there's a huge learning curve when we're introducing new technologies into an environment, especially a hybrid environment. And this can put a lot of pressure on healthcare providers and patients alike. John, how is Moffitt Cancer Center able to approach this and make it so successful?
Yeah, a very powerful case study there, Brandon. So one thing to note that wasn't brought up in that video is really where Moffitt came from before they made this transition. And it was really an environment that was very expensive, very complicated room systems that were not only difficult to manage, but difficult to use. So adoption really struggled with using the previous technology. However, working with Zoom and Logitech, they were really able to simplify their room designs and the deployment, while really focusing on keeping the end user experience simple and easy to use. And that's really where you see how they were able to deploy Zoom to 6,000 users within a 2-week span, including all of their conference rooms. Now meetings are just easy to schedule. And with Logitech Zoom rooms in place, they walk into the room, their meeting's all ready to go, and they have a one-tap experience to join and get started.
Yeah, if I could just add some commentary here too, Brandon. Some of the words that stuck out to me were simple, seamless, and quick. Over the past year, Logitech and Zoom have been bringing that ease of use capability to users, whether they're in a remote location, teleworking, or in these conference rooms. And I think, the adoption of our technologies is really rooted in our ability to enable users, regardless of their use case, to work quickly and get up and running quickly. And there's really that easy to use plug and play capability that Logitech brings to the table. And in partnership with Zoom, I just thought that the Moffitt Cancer Center really showcased how not only can these solutions be used to have a direct impact on the efficiency of the staff, but it also has a direct income on patient outcomes. When you are able to have a live interaction between the pathology department and the ER so that you can decrease the amount of time that a patient is under anesthesia, that has a direct impact on the ability to deliver better patient outcomes. So again, a perfect use case to demonstrate how having that simple, seamless technology that can be deployed in any environment, it was key. So thank you for sharing that.
And this is why, Logitech and Zoom, that partnership is so great from a solutions provider like Rahi, right? When we deploy systems into these environments, if they're not easy to use, if they're not simple for people to adopt to, they don't get used. And that leads to a very frustrating experience for the end user. And quite honestly, wasted money at that point. So using these solutions and bringing them into the environment and making it easy and easy for the end user to adopt to, nothing can be better, right? And oftentimes we get a lot of questions around, what's the difference between using Zoom meetings in a healthcare setting versus Zoom rooms? John, people like to know, why can't I use just meetings instead? Can you elaborate a little bit on that?
Yeah, sure, Brandon. So this is a common question that I get all the time. The difference really between a Zoom meeting license and a Zoom room is that the meeting license is really tied to an individual. It's really designed to work from an end user's personal devices, whether it's their smartphone or tablet or even a computer with a webcam. When you look at Zoom rooms, these are typically dedicated to room hardware in a physical space. And that room is typically shared between multiple users throughout the course of a day or a week. And it really comes down to being associated with an individual's calendar or a shared space that people can come and go and still be able to leverage that equipment.
Yes, and if I could just add it, here, I think this is, if you look at the Zoom meetings, this is what we've all come to know and experience over the past year, right? I have my Zoom meeting license. We all are using our Zoom meeting license to participate. However, when you look at a Zoom room, it's how can we associate a dedicated room solution in that space? What are the options we have? So Logitech has either, we have the dedicated room bundles that you can customize. They're more modular in nature. So if you have a classroom environment, you could maybe place your camera in a different location, speakers in a different location. Or if you're, again, going back to your Zoom meeting room license, you could have a webcam that is associated with that. So Logitech supports that either platform, whether it's your Zoom meeting or your Zoom room license, but there's a unique value experience that Logitech brings to a Zoom room that you don't get from a Zoom meeting experience.
That's really, that really echoes what the message we're trying to land today with ease of use and just simplicity, right? Outside of just the meeting room, Zoom actually, it offers a lot to the whole campus environment. John, can you speak to some of the additional features that a Zoom license brings to the overall campus environment?
Yeah, I was just going to, I'm sorry,
go
John,
ahead.
if I could just share with you really quickly, if you don't mind, I apologize for that. I just wanted to call out the one piece that I think is so important before we jump into those extra features is that single user interface, and that is whether you have a small, medium, or large room, whatever deployment option you have for a Zoom room, the unique value Logitech brings is this tap user interface, and that has that integrated calendaring capability. It allows you to simply and easily share content within that Zoom room environment. And there's some other features, I think, John, that you were just about to talk about, but I couldn't let you get started without talking about that one user interface that really drives it home. But I would love for you to talk a little bit more about the other pieces that are involved.
Yeah, sure, Roseanne. That's great. And the single user experience across any device is huge. That's really where people can seamlessly transition between conference rooms and operating rooms and still know how to use the technology. When we're talking about inside the conference room, the value that Logitech and Zoom bring together is that we can do more than just basic room capabilities. So yes, we do two-way video very well and content sharing, but also bringing in digital whiteboarding and annotation into those live meetings to bring a deeper element of collaboration there with our Zoom Room for Touch portfolio, or the ability to have a companion whiteboard next to the video system. When you start to look outside the conference room, this is really where the power of the Zoom platform it resonates and gives additional value to customers that are using both Zoom and Logitech. So this is really where we give the ability to schedule rooms from panels right on the outside of conference rooms. And then digital signage is particularly interesting right now because this can be throughout the medical facility or throughout the office floor plan. And it's a way to keep employees and guests safe and informed about events, and you can incorporate branding and even wayfinding capabilities for people to very easily navigate that facility or get to available rooms that are there. Even down to the ability to put a virtual receptionist at the front lobby where we can keep receptionists safe as they interact face to face with people that are coming and going and checking into the lobby. So a whole lot of additional capabilities beyond just traditional conference rooms. And the value there is even with a single Zoom room license, you could deploy digital signage across the entire organization, with no additional cost there. Go ahead.
Yeah, John, that's really powerful in terms of the functionality, right? So, you talk a little bit about the companion whiteboard or the Zoom Room Touch that could be integrated into the conference room. And I just want to jump on there that, it's truly all about choice, right? So you can go into these room environments. Again, at a desktop, you might have the headphones or a webcam at that location. If you're doing a continuing medical education course, you might have a spotlight remote that allows you to point or to advance through slides. So these are just those accessories and pieces. But as you navigate into those Zoom rooms, those modular designs, you might have a Logitech Meet on the left-hand side with a PC or a Nook. You can actually add on additional microphones and speakers, and obviously, depending on the Rahi team to guide you through selecting the right choice. But we've got these modular room bundles. And then if you go over onto the right-hand side, Logitech has a new appliance-based portfolio. So you don't have to have a PC associated with those room solutions. So again, it's all about choice from our room-based systems that integrate with those rich features that the Zoom platform brings to do that integrated whiteboarding and companion whiteboarding capability. So very powerful. One of the things that I think is unique about what you said, John, is that a lot of times when our customers are looking at how do I deploy video collaboration in a conference room, they're thinking about this conference room or a specific use case, administration, or I'm focused on patient care. But with Zoom rooms, you have this ability to really look at the hospital system or as a campus, basically, right? You can actually deliver all of these unique value-added features that digital signage, the virtual receptionist, it's so unique and very powerful to look at an entire health system holistically versus just a room by room basis. So it's a great partnership.
Fantastic. And, we've talked a lot about the technology and the hardware and all that, but, one of the most important things is how do we fund all this, right? Where do we get the money from? What assistance is available through Logitech and Zoom to help these institutions and providers find the funds available to deliver these solutions to their environments?
I'd love to jump here on this one, Brandon.
Yeah.
Yeah, as you know, Logitech launched a grant services program last year, and we're really excited about that. The grant services program, when customers have a need to apply for supplemental funding for their organization, they just reach out to Rahi, and they will connect you with one of our grant experts. So it's a really seamless process to get in touch. We will help guide and consult you through the grants process. However, also, last year in March and December of last year, as well as this month, there were several legislative packages that were passed, and there's stimulus funding that's been put into the market. And this funding is available for healthcare organizations that does have an expiration date, right? So June 30th is some of the funding that's available through stimulus that is available to healthcare systems, no strings attached, that they can leverage to invest in virtual technologies for virtual care, for remote work, for their software licenses, for their hardware needs, anything that has been used to help them prepare, respond, or adapt to what's happening with COVID. That stimulus fund can be used to invest in technology to support their needs. So it creates this unique opportunity to transform healthcare organizations today versus having to wait to apply for a grant and get supplemental funding 6 to 12 months from now. So our funding experts, our grant services program, and it's really just our funding experts now, you do have access to basically complimentary services. It comes at no charge, and we can actually sit down with you and help you figure out what are the things that I need to put on my application for stimulus funds? So if you're trying to apply for stimulus funds today, we will sit down with you. We'll look to understand what your use cases are and your needs, and we'll help you build out that project plan or those use cases that will help your organization really make the most of those stimulus funds. So let's just say it's a year from now, after your stimulus funds have run out. The great thing is Logitech doesn't have expensive maintenance contracts that you have to pay year after year. So you can be sure that you're not going to have any hidden cost creep up from you. But the other thing that we have in place is we can work alongside you with Rahi to say, okay, we understand that you've really taken advantage of telehealth for these administrative use cases. How do we expand that? How do we offer, how do we do partnerships within our community, maybe with rural health clinics, maybe or with school-based healthcare clinics? So we can work with you to maybe apply for grants to help you expand or extend services beyond your health system. So just some options and ways that you can leverage Logitech's grant services programs.
And as a solutions provider, I can tell you, we've leveraged your program several times with our clients, and the burden that takes off of them and really makes the process so much easier. I can't tell you the value add that brings to the table. So it's a fantastic program. We have about 5 minutes left. If we have any questions that have been asked, Simon, do we have any questions from the group?
The first question we have, does Logitech have mobile cart solutions for healthcare environments specifically?
I could answer that. Well, Logitech does not have a bundled mobile cart. What we do is we work through our partner Rahi to understand your specific needs that you have for a telehealth environment. For instance, your mobile cart might be a lightweight mobile cart that you want to pair with a webcam. You might want to pair a room system for a conference room. So again, Rahi is going to be your expert in helping design and build. What Logitech likes to focus on is having those flexible, adaptable solutions that can be put on any type of cart that optimizes your specific telehealth environment. So again, we partner with Ergotron, we partner with Triton, we have a number of collaboration partners that we work with and that also Rahi can integrate into. So just we don't have a specific cart. Again, our focus is on those flexible, adaptable solutions to accommodate whatever the needs are.
And it's to note as well, to jump in here a little bit to Roseanne, is from Rahi's perspective, we're able to take whatever design is needed from your perspective and kit that here at our facility. So we can keep people out of your facility deploying this by designing and building it all here in-house and either shipping it directly to you for your IT team just to stand up and plug in, or we can have somebody on site to roll that out for you. But that really streamlines the process of deployment as well and customizes each cart to really fit each user's needs.
That's a really important point, Brandon. Being able to stage that equipment before it's executed or rolled on site is a huge value add. So great point.
The next question we have is, what are the typical license lengths for Zoom licenses, either Zoom meetings or Zoom rooms?
Yeah, great question. So we are very flexible with licensing. So we have customers that are committing long-term to 5-year contracts, 3-year contracts. We have annual contracts, and then we have customers that are going month to month. So definitely flexible. There are obviously different types of packages available for longer-term commitments, but we're happy to work with whatever the needs are of our clients. Especially working with Rahi and Logitech to put the right solution and the right commercial package around what the needs are for our customers.
Eric Leiters asked, is there a radiology-oriented solution, specifically a peer-to-peer Zoom solution for virtual imaging review?
John, are you able to answer that one?
Yeah, nothing that I can comment on for right here. I don't know if the Logitech folks have any specific experience with that. I know we have plenty of enhancements going on to continue on with the value add, but nothing specific to talk to at this point.
Radiology, I would just recommend scheduling some time with the Rahi team to find out your specific use case and what you're trying to accomplish. We can get the details of if it's an imaging quality that you're trying to pass the high quality images over the network, or what exactly how you would try to use that technology in your space would probably be a good place to start with Rahi. And then we can get the right technical resources to answer that question for you.
Yeah, to add to that, I think that really builds upon what we kind of mentioned earlier about getting a solutions provider like Rahi into the conversation early, right? So we can talk through these different use cases in different departments and their exact needs and really figure out the right technology to put behind it to make sure that we solve for those challenges. And I apologize, I'm sure you all just saw my light turn off. So any other questions, Simon?
That is the last question we have.
Excellent, thank you so much. Again, quick reminder, Eric Horn from the Rahi team will be following up with each of you to see if you need additional information, and we'll make sure to turn on that and provide that for you. Today we talked a lot about how Logitech and Zoom can help simplify the experience for healthcare providers and patients. If you have a need for any of these solutions within your space, or you just want to optimize any of your current spaces, reach out to the experts here at Rahi. We have experience in rolling out Logitech and Zoom solutions in a variety of environments, both big and small. Bring us to your next project and allow us the opportunity to deliver a better experience for both your patients and your staff. Reach out to us via email or give us a call, and we'd be happy to help. Thank you again for taking part in today's discussion. Be well.